The Domestic Violence Prevention Program is congressionally mandated to provide resources for tribes to create violence prevention and treatment services in Indian country. This support comes through a national grant program administered by the Indian Health Service, and DVP is making a positive impact in Indian country. How? By promoting evidence and practice-based models and strategies that are culturally informed prevention and treatment approaches to domestic and sexual violence. This program is community-driven and offers provider and community education, increases access to prevention, advocacy, and crisis intervention services, as well as building tribal capacity.
My name is Melanie Jones, and I am with Choctaw Nation Behavioral Health. I work with the Domestic Violence Prevention Grants. Choctaw Nation Behavioral Health, we're aware of the correlation between substance abuse and domestic violence, and one of the things that we wanted to address was our women in recovery. Homophobia Ribbon is our DVPI grant, and they focus on healthy relationships, domestic violence, and they do prevention and education in our communities. Some of the things that they do are classes with our high school students, and then they also offer community events for women's self-defense. Project Strong is our DVPI grant. We have 2 forensic interviewers that work with law enforcement, child welfare, our legal system, and they do interviews. They are advocates for our clients. We involve culture with our patients, our clients, our community members on an individual basis. Choctaw Nation, our foundation is faith, family, and culture.
One of the activities that's having the biggest impact through Homophobia Ribbon is our women's self-defense events. And we have been seeing women finding their voices.
With domestic violence comes a lot of trauma, trauma to the victim, trauma to the family, trauma to the children. Domestic violence comes so much mental health issues, trauma, depression, suicide, increased substance abuse issues, increased anxiety, a lot of self-injurious behavior as well. It's not just women that are victims of domestic violence, but men as well. The biggest impact has been the work that we've done with Chihuly. Chihuly is our women's residential treatment center. This program has really helped to make the women stronger, physically, mentally, emotionally, spiritually, through the work of the Taekwondo program. Some of the biggest successes have been increased community interaction, a lot of collaboration between the health system, collaboration with law enforcement, collaboration with our judicial system, but then also collaboration within the health system itself. Project Strong is important to the Choctaw community because it really offers a sense of community, it offers a sense of safety, and it offers a sense of resilience for the women, for the men, for the children that have utilized the program. The importance of the Homophobia Ribbon program to the Choctaw Nation and to the state of Oklahoma has really been a need for consistent and constant resources in the community and availability to educate individuals, educate children and adolescents on the importance of being safe, of being domestic violence free, and being free of bullying as well.
I am Sandy Hall. I am a forensic interviewer and a victim advocate.
And I'm Jennifer Heflin. I am a forensic interviewer and a victims advocate.
The role of a forensic interviewer is to conduct an interview with children that have allegations of child abuse. Each person has a role investigating child abuse, whether it's law enforcement, child welfare, the forensic interviewer, the child advocacy centers, the pediatric SANE.
We are fact-finding, neutral interviewers. The child is always first, and so we all work together for the best for the child.
We have several programs within Choctaw Nation that helps victims with resources if it needs to be housing or utilities or shelter. SAR is Sexual Assault Response Team. It consists of the SANE nurses, which is the Sexual Assault Nurse Examiners, victim advocates, law enforcement, and prosecution, and also just many other resources available. As victim advocates, we are able to take that walk with victims from start to finish.
My name is Gary Batten, Chief of the Choctaw Nation of Oklahoma. We definitely support the domestic violence programs as well as all tribal programs that we have to unite our families and to help our families go through difficult times. Some of the changes we've seen since we've implemented the DVPI program is behavioral changes. And again, it's about empowering our young ladies. And so a lot of them, they get self-defense training and so on. They are important to us as the Choctaw people, as a tribal leader. They're important to us. They're important to their family. They're worth it.
Yo halena, yo halena, yo halena, yo halena, yo halena, yo halena, way yo hey yo halena, way yo hey yo halena, yo halena, yo halena, yahoo. Yo.